If you do that, hospitals, pediatric practices, maternity wards, nutritions will all cease to exist in America, and no one will have access to care.
Already happening.
You should be very careful when you say you lead pediatricians and you care about access for children in the words that you put to a paper and publish in a journal. And Medicaid for All is not supported even within the American Academy of Pediatrics by the people that are insightful and in leadership roles. That paper should have never been published, not
Yes.
with the title.
Thank you, Dr. Bravo.
Well, the next question is,
Here's the thing too, right? A tangential conversation to this is this whole idea of value-based care. We need this new system, and that is what's going to save pediatrics and internal medicine. And the thing is, I remember I can't remember if it's either a partial lesson or a Chip Hart, one of them made the point. They said it doesn't matter what the system is in the end, as long as the payments are set appropriately. You can have 5, 10, and 15 different systems. The payments, they're just a system, right? And in that, you're plugging in somewhere in there, you have some sort of variable that is going to be a base rate that is going to affect all the other payments. And no matter what the system is, that could be set high, that could be set low. So you can change the system 5 different times and we can still not come out in any healthier of a place. Even right now, they're talking about value-based contracts and payments and plans and so forth. You know what? They don't work yet because they still don't have enough money allocated in the budget for children because they don't care. It all costs money, so they don't add money into the budget.
I think I push back about they don't care. That we all care about what's causing us pain right now. So the government has a problem because they have to take care of either people who are absolutely disabled that need care now. If you're in a nursing home because you're a quadriplegic and you don't have a dime to your name, you can't be set on the street and say, okay, you're going to die, but who cares? You can't do that. Not in a society that cares. You can't leave elderly folks that are dual enrollees in Medicare and Medicaid and are either heavy on home health or in a nursing home, very debilitated, kick them out on the street and say, okay, fend for yourself. You're going to die in the park. That's okay. Those are real pain points today. So the money goes there. And I have to separate it. And you have to say, we need to spend more on prevention. And that's not hurting us today. The knee doesn't hurt. But if you're not watching your weight, you're not exercising, it's going to hurt 20 years down the line. And you're going to spend a lot of money. So when you say value-based care, doesn't work because preventive care is about investing in the future. And that asks that as a society, we figure out how much are we going to invest, who's going to borrow the money for the investment, and how are we going to pay for it? It all comes out of our pockets one way or another. But how are we going to pay for it? Are we going to do a tariff in hospitals and health plans? Are we going to increase people's payroll taxes? Are we going to increase the federal taxes? So we do this, do we increase property taxes in the communities like they do schools? That's how they fund it. But that's a real conversation. When you hear these people talking about fee for service and value-based, they're morons. And all they have is a bunch of talking points. And they keep circling around the same talking point, throwing it in ChatGPT, publishing it on a LinkedIn profile, and thinking that they're geniuses. That's not the problem. The problem is we haven't answered the fundamental questions. How much do we invest in our children? How do we finance it? And how do we find the pay for it? No one wants to have that conversation.
Correct.
It's a real conversation.